As Tom stated, we are in partnership with the deaf community in service delivery. COPD, as a social service agency, adopted the philosophy of interpreting as a part of its services. In-person interpreting services, as requested by the deaf community, were provided to over 12,000 people through the years. The interpreting business is made up of three stakeholders: the customer, who is a deaf person, the customer, who is the entity requesting the service, and the bridge to the communication, the interpreter. There are complications within each of these that dictate our business decisions. A change occurred in 1995 with the advent of affordable smartphones and video conferencing technology. Most consumers were provided with video phones in their homes, and video interpreting began. National firms provided this video service with business efficiency overshadowing the provision of quality matches, and changed interpreting delivery to be both in-person and video interpreting, and from a very local community-based service to national providers. This change impacted us with the beginning of a decline in revenue. COPD has responded through the years to reduce the impact.
In 2010, due to the continual decline in profit, the interpreting department streamlined. We centralized business functions, and with these actions, enjoyed 5 years of profitability until 2016. As we analyzed, two key factors emerged contributing to the lack of profitability. First, the ratio of employee costs to revenue, represented by the orange line. The blue bars represent our bottom line for the year. The second factor was the decrease in volume that occurred due to competition and their increased use of video interpreting. This is represented by the green line. The number of hours served has been slowly eroding since 2015. From 2015 to 2019, additional challenges emerged. Contract workers began turning down assignments, citing our rate of pay was not competitive. Many large national companies entered the market, producing a one-stop service to the businesses, offering both in-person and video-based interpreting. All of this reduced our hours of service and increased our dependency on employee workers. Each year's troubles demonstrated forward impact, compounding losses. In 2018-2019, we attempted to enhance our competitiveness, including a scheduling software which incorporated service efficiencies and video interpreting. The software failed in both intended outcomes, resulting in poor customer satisfaction and no access to a video platform. When the 2020 pandemic hit, we had an urgent need to launch video-based interpreting to try to recover from an influx of cancellations for in-person interpreting and to adapt to the new reliance on video. In light of the challenges we faced, we looked to see if we could carve out a unique position in this competitive landscape. We began by evaluating our competition and identified Sorensen, a national company who was beginning to establish a local presence in our markets, as our chief competitor.
Surveys of the three stakeholders, the deaf person, the paying customer, and the interpreter, aided in identifying problem areas and provided direction. The deaf person, who uses visual sign language, are as similar and dissimilar as all of us. Many deaf people, due to education, minority status, co-occurring disabilities, often have limited languages, relying on the specialized skills of an interpreter to aid between home signs, gestures, and sign language. They require specialized communication. The surveys confirm that our deaf beneficiaries want well-matched interpreters. Businesses have not budgeted for accommodations and are mostly unhappy with the unfunded ADA mandate to pay for the service. They don't understand the value of a good match between the language of the deaf person and the skills of the interpreter and the need for a specialized translator, nor do they understand the liability if ineffective communication with their consumer occurs. The surveys revealed our need to improve customer service and efficiency, from requesting an interpreter to invoicing for the service, as well as a desire for us to be a single source provider of both in-person and video interpreting. Interpreters have various skills within the profession and must go through rigorous national testing and certification to be licensed to work and to be matched correctly. Our service model focuses on the preference of the deaf person, using both staff interpreters and independent contract interpreters. Determining loyalty from contract interpreters was essential. Surveys conveyed that our department needs to be more responsive in its customer service and that our rates are up to $10 an hour under the market.
Understanding our market, we then defined who we are and what makes us different. Our service is local, developed over 4 decades of grassroots engagement with deaf leaders and community members, which has forged strong bonds and trust and enabled us to provide highly customized, tailored bookings.
There are some people in the deaf community that really feel comfortable with a specific or a few interpreters because they know our histories, they know our backgrounds, they're able to choose the right words that we really are conveying, feel very confident with them. There might be other interpreters, though, that we meet occasionally in our life that we feel are just a mismatch. They just don't really feel a flow with them, but then other deaf people might be okay with those interpreters.
Our target market isn't an industry, but rather the deaf individuals with intense need for matching, wherever they need to communicate. We promote their autonomy and inclusion so that they feel comfortable and confident that interpretation is accurate and clear. And when our service is profitable, the proceeds return back to the community to provide them with other services they need, such as counseling, employment assistance, and case management. For paying customers, we instill trust in the content conveyed. We match the unique needs of the deaf individual, the skills of the interpreter, and the context of the business, and we ensure accurate and complete interpretation. Contractor loyalty stems from reliable pay cycles at a market rate and the sense of giving back to the deaf community, values that they embrace and cannot find with other employers. We have drafted a 3-year plan to return to profitability with a reduced ratio of employee costs to revenue and an increase in hours served. We will reduce the percentage of hours performed by employee interpreters in favor of contractors by raising our rates to contractors to attract them to us. We will increase revenues through both scheduled and on-demand video interpreting. On-demand video interpreting allows a customer, with a click, to summon an interpreter who can be located anywhere in the country. This adds a new feature for customers who struggle with getting last-minute interpreters, and it taps into a new workforce which does not compete for the limited availability of local interpreters for in-person appointments. We will increase awareness and preference for COPD with intentional and routine marketing by a 3-way partnership with our stakeholders. We will implement tools and policies to improve our efficiency and customer service. By 2023, we estimate that our service will impact approximately 10,000 beneficiaries in that year. Understanding our stakeholder groups and working to redirect the program to profitability, we have determined that there are several strategic initiatives we need to undertake this fiscal year to combat the challenges of the past 5 years. We are already in progress with increasing productivity and customer satisfaction with new software. We're partnering with Interpreter Intelligence to provide software that handles request management and fulfillment and billing efficiencies, as well as launching on-demand video remote interpreting. The new software will increase scheduler efficiency by 20%, helping to reduce the ratio of employee cost to revenue, and improve customer satisfaction for both businesses and interpreters with quicker response times from schedulers. On-demand video interpreting will add a new revenue stream, utilizing a less expensive and expanded labor force. We strive to additionally improve customer satisfaction through community engagement, with more routine scheduling of stakeholder focus groups, surveys, and follow-up interviews to remain attuned to issues and desires. We also plan to create opportunities to promote engagement and continue to build loyalty and support from the deaf communities we serve. We will increase our beneficiaries utilizing our relationship with the state commissions for the deaf and hard of hearing, along with hosting focus groups, coffee chats, and community events to continue to foster beneficiary engagement with us. The new software, coupled with incentives such as offering free or low-cost continuing education opportunities, and implementation of future rate increases, will build interpreter loyalty. We plan to increase market presence and branding with a concerted focus on marketing to include improvements on our local websites and social media presence. We are partnering with the University of Arizona to utilize internship opportunities, which will help us launch marketing objectives, with a plan to develop a formal marketing program to expand our capture of our local interpreting markets. We will also investigate our price model and seek opportunities to raise our rates to businesses as feasible. Our unique value and competitive differentiation is that we know the skills of the interpreters and needs of the beneficiaries and have a process to ensure effective communication. And with these integrated set of activities for each of our initiatives, we will build our competitive advantage, the ability to secure favorable profitability in the face of competition.